Good morning or good evening. And first, I would like to thank Dr. Hani Ateba for giving me the opportunity to speak in this important gathering. I'm very happy and willing to cooperate in the near future. I will speak about the situation in Egypt. We have success and we have challenges also. Regarding the landscape of the disease, I would like to compare our situation in Egypt and in Eastern Mediterranean region compared to all other countries globally. Now the cumulative cases, it's more than 140 million. In the Eastern Mediterranean, it is only 8 million or 8 million more than 700,000. So it is not as high as the Americas and Europe. This diagram shows, also how the Eastern Mediterranean, the green curve, is not so much compared to the Americas and Europe. This is the curve starting from early, showing the first wave, the second wave, and now we are in the third wave. This slide in Arabic, but it shows the number of cases per 100,000 cases in the Eastern Mediterranean region in the period between 11th and 17th April. It shows also that Egypt is only 5.7 per 100,000 compared to other countries in the region. And Bahrain, for example, is the highest number appeared. So yes, we have a problem, but it is not as hard compared to other countries in the region. These data based on the cases detected by the government, but we have many other cases not detected. It is in the private sector or stay at home. So this is the situation in Egypt, and you know that the population is more than 100 million people. We recorded more than 200,000 cases and 12,900 deaths. As I mentioned, there is a first wave and the second wave. Now we are in the third wave. Every day, the Ministry of Health presented this kind of figures indicating the number of cases per day and the number of deaths and the total number of cases, accumulated cases. To highlight what happened in Egypt, again, the index case started in the February 14th, 2020, and started to spread all over the country, but it is concentrated on Cairo, Alexandria, and Damietta. Males above 60 years old was the highest occurrence, and it appears, in area where the tourism is high, like Luxor and Hurghada. This was the beginning of the spread in Egypt. Now, in April 2021, there are many cases appeared in concentrated in some governorates, especially in Upper Egypt, like Kena, Sohag, Bani Suef, Syut, and also in the Lower Egypt, like Kafr al-Sheikh, Port Said, and other governorates. The government did a lot of health measures to control the infection, like establishment of several quarantine hospitals, either at the Ministry of Health or at the universities. There are creation of emergency medical teams and standardized guidance for diagnosis and treatment by a specialized committee. They differentiate in the treatment between the mild, moderate, severe, and critical cases, and established a treatment regime even to send it to homes in case the person cannot go to hospital. There are several mechanisms for communication with people, like hotline, by Ministry of Health or WhatsApp or so on. to answer questions and lead the patients to go to which hospital and treatment of cases. There are precautions at the airport and the border. There are protocols for and clear instruction for prevention and controlling the case, and follow up and evaluate the situation at high risk time. And there are awareness program for potential risks. So what happened in Egypt? Of course, we have cases, severe deterioration in older males and above 50 years old, especially if they have other comorbidities. And there are adverse psychological impacts on individuals, and the affected physicians affected the situation, because mortalities in physician give is not it's a harm to the healthcare system. There are certain indicators by simple blood sample. These most of the people use these kind of indicators because the PCR is not sensitive, and many false negative cases happened and they appear to have the disease. Nationally, we should follow the regional plan for action developed by the WHO, and there are 8 pillars concentrating on the coordination at the country level, the planning and monitoring, the risk communication, community engagement, surveillance, rapid response, the point of entry to the country, the infection control, the case management, operation. So all these pillars are taken care of by the government and the people taking care of the COVID. The country also realized that the resilient health system to the COVID and to the pandemic is very important, and actions taken for training of personnel, for equipping the facilities for the sustainable system, the strong primary care, the community participation, and the reliable referral systems. Regarding the national program, as it was mentioned, there are many vaccines developed by different companies and countries, and we are very happy to find this appeared, because during the beginning of the COVID, it was only the hope to have the vaccine. And there are many vulnerable population groups, they need this vaccination, and we are happy also to know that there are several additional vaccine candidates are developed. In Egypt, we have mainly the AstraZeneca vaccine, the Sinopharm from China, and the one from Russia. The WHO believe that everyone, everywhere, who could benefit from the safe, effective COVID vaccine should have access to quickly as possible to this vaccine. And after vaccination, of course, we should continue wearing the masks, physically distancing, and avoid the crowds. And still, it is not clear the degree and at which extent the vaccine can protect the people. That's why people are hesitant to take the vaccine, and it should be the scientific community should advise about this problem. The World Health Organization and other partners developed this framework of access to COVID tools accelerator. All countries should receive doses in proportion to their size to immunize the highest priority groups. You may know the COVAX, it is for spreading up the development of safe, effective vaccine, for supporting the manufacturing capabilities, and to ensure fair and equitable allocation of the vaccine. Egypt is a member of this COVAX agreement. The situation of the vaccine in Egypt, yes, the country agreed to purchase 20 million doses of the Sinopharm, already 1.5 million doses of Sinopharm or AstraZeneca available. There are trials also to produce the vaccine, either the Sinopharm or the Russian Sputnik. The actions taken first to test the vaccine through the drug authority, the Egyptian drug authority, for approval, and to contact the companies for contracting and for vaccine distribution. It should be according to the priorities. And they developed the website to register citizens to find out who will be vaccinated. People register at this system, and if they cannot deal with this technology, they go to the nearest healthcare center to help in this electronic registration, and may call hotline to help them for registration. The government started this national program, and they started in January 24th by the medical teams and the healthcare teams in hospitals, either at the Ministry of Health or the universities. They started to be vaccinated. And then the second line is the elderly citizens with chronic diseases, and they try to secure large number of doses for other Egyptians. Awareness made for minor side effects that appear after the vaccination, and observation for any side effects. We have now about 200 center for providing the vaccine, and distributed all over the country, and there are possibility of increasing the number to increase the possibility of vaccination. Regarding the perception and willingness for vaccination, this vaccination hesitancy is present everywhere, and we believe that it needs really scientific studies to see how and why this vaccination hesitancy happened. About 30 to 50% of the Egyptians are reluctant to be vaccinated. They are not confident about AstraZeneca vaccine due to the announced side effects, and previously infected persons believe that they are already protected. They don't want to be vaccinated. As regard the number, it is about 500,000, but the actual number I didn't find. And there are increasing in the effort for increasing the immunization of medical staff and increasing the number of centers providing the vaccine. Effort, made and collaboration with NGOs and international healthcare agencies to finance the purchasing of the vaccine and help the government, and also to have awareness campaign to advise them to be vaccinated. The challenges, it's a fact that COVID-19 is spread out, and no one is protected except if they are vaccinated and showing all the precautions for prevention. There should be equitable access to vaccination, and as you know, the large number of population needs a lot of protective measures and a large amount of healthcare services available, and the rollout of the vaccine, COVID-19 vaccine, according to the plan. Also, the economic situation. Usually, there are a balance between the economic status of the country and protective measures and lockdown or not lockdown. They don't want to affect the economic status of the country. Besides, the climate changes that happen may have also a direct or indirect impact on COVID-19. Thank you very much. I'm willing to answer any question.
Thank you very much indeed, Professor Anwar. That's very helpful, really, landscape. Could we bring Tonya? Yeah, I've got one question, really, which is probably running in the minds of a lot of people around. You have quoted that the prevalence per 100 million population in Egypt is 5.7, while it's 453 in Bahrain, which is in the same reason. And then at the end of your talk, you said that there is a link between the economic status and also the protective equipment. How do you reconcile the difference between a rich country, relatively, like Bahrain, with a very high rate of infection, and Egypt is only 5.7 per million population? Are these reliable numbers?
I mentioned at the bottom of this diagram, it was in Arabic, but you may read it, that these numbers depend on the announced number, the number of cases announced by the government. I showed you the diagram showing the Ministry of Health announce the number of new cases every day. And the real number of cases, you can multiply this number by like 10 or 20, because there are a sector of private sector, and people stay at home and treated, without reporting. So
yeah,
there is precaution in this diagram that it is not the real number announced.
Yeah, it might be the reporting. Tonya?
And trading may help. Yes.
I guess it's adding to that. I guess your reported case number is always depending on the tests that you do. Is there any seroprevalence data that you have to suggest the kind of community exposure in Egypt?
I am trying too hard to do this study, because it's not done regularly. It is expensive. So all the data depends on, like a research kind of information, not the regular information. Even if they do the rapid test, it is not reliable. To depends on the data by the rapid test.
There's also a question about in the chat group asking if the decline in case numbers that you've seen in Egypt is related to vaccination. But from what I know, the proportion of the population that's received one dose is small. It's less than 1%. Is that correct?
I did not mention this. And I'm saying the number of cases in the Eastern Mediterranean region is less in Egypt compared to other countries in the region.
Okay.
But I didn't say it's a decline. Our curve is the first wave and then the second wave, and now we are increasing. The number is increased. The effect of vaccination not started yet. We are just starting the vaccination.
Can I just come in very worrying, alarming figures that mention the mortality among healthcare professionals in Egypt is, from what I hear in social media and from you, that it's quite high. Why and what measures do you think the government or you are suggesting? Thank you.
Maybe they are highly exposed, and maybe the reporting of doctors when they die, it is very clear and it is reported. So that's why the percentage, maybe it's a kind of real data.
Okay, thank you.
That's why they started the vaccination for the medical staff, because everybody's worried about them, either the doctors or the nurses and all the medical health staff.
I think there are quite a few questions about hesitancy, but I'll bring that for the group at the end, perhaps, and we give Tonya the floor to introduce the next speaker.